Okay, so this is my speech for Speech 1100 at COD. It is the policy speech on female genital mutilation, or FGM, also known as female circumcision. Susan Brink from NPR.org said on July 21st of 2015, more than 500,000 girls now living in the United States are considered at risk for female genital mutilation. The procedure ranges in severity from removing or cutting the clitoris, which is the primary sexual organ responsible for female sexual pleasure, to sewing the vagina shut. The United States should allow female genital mutilation with several stipulations on women being of a legal consenting age and being completely informed on what is going to happen when they have this procedure done. So female genital mutilation is illegal in the United States with the exceptions of piercings and tattoos. But it still goes on with quite a surprising number. Young girls are taken to their families' home countries to have FGM performed, or they're done here in very unsafe environments. If the United States legalizes it, we can make it safer, improve upon the procedures, and it will ultimately be less traumatizing for girls and women who choose to have this done. I've studied female genital mutilation in many of my classes. I understand it, and I respect the rites of passage and traditions of it. However, I think that it can be improved upon. So these are a couple of the points that we're going to talk about today. Making FGM illegal forces it to be done here illegally in unsafe environments, or going back to their home countries to have it done, where it's even worse than having it done here. They'll do it outside. And allowing FGM to be done on women who have been informed of what goes on and happens, and allowing them the choice to have it done by a licensed, trained professional in a sterile environment allows the tradition upkeep and no traumatization. Making FGM illegal only forces practitioners to do it themselves, or sending their young girls and women to their home country to have it performed. According to an unknown author from WHO, which is also known as the World Health Organization, updated on February 2014, only 18% of all female genital mutilations are done by healthcare providers, meaning a licensed medical professional. Most are done by traditional circumcisers who have no medical knowledge. They have simply been passed down the right to be a circumciser generation to generation. According to Alice Aching from the Huffington Post on July 27th of 2015, when female genital mutilation is done in unsanitary conditions, the immediate female genital mutilation complications include severe pain, shock, hemorrhage or bleeding, tetanus or sepsis, which is a bacterial infection, urine retention, and open sores in the genital region. And injury due to nearby genital tissue can also result in a secondary infection. Long-term consequences include cysts, menstrual difficulties, recurrent bladder, and urinary tract infections. They have an increased risk of childbirth complications and newborn deaths, possible bloodborne infections such as hepatitis B, and HIV, because when they're done in a home country, usually everyone in the village comes in, and they'll have a group of girls do it together. They do not sanitize the knives that they're using between women. So your blood contact to the next person, blood contact in an open wound can cause hepatitis B and HIV. They will also have permanent scarring and keloids. If we as a nation regulate who performs FGM and how it is done, who it is done to by age and consent, women who want to uphold these traditions and understand what they're doing, it allows them to do it in a safe manner. So women who have FGM done should be of legal consenting age. They should know exactly what is going to be happening, and of course they should make the decision of their own free will. Alice Aching from the Huffington Post also says that girls growing up, they knowing that FGM is part of their tradition or identity, and because they want to continue and uphold that into the next generation, when they become parents, they are more likely to have their children undergo FGM as well, even though they know how painful and terrible it was. Since FGM is clearly a cultural tradition, paving the way to making it safe and not traumatic will reduce the amount of young girls and women who choose to have this procedure done, because the majority who are having it done, it is being forced upon. Shelby Quast said in her interview on Newsweek.com that there is a lot of education that's required of the public, the government, and even within the diaspora community about what their rights are. Even though she does not support FGM, she obviously agrees with the fact that education and rights are the root of our problem here. If we educate these young women about what is going to happen and we make it a sanitary and safe environment, those who do not want to have it done don't have to have it done. And those who choose to uphold those traditions are allowed to, and nobody can force that upon them. Faduma, who was interviewed in Homa Khalili's article on TheGuardian.com, said because it was a tradition, she was excited, even eager to have FGM performed. She saw other girls have it done. She knew it was painful, but she also knew that it was a rite of passage in her community. She did allow her daughters to have FGM performed in fear that they would be outcasted if she did not. Men in Somalia would not marry what they consider uncircumcised women, meaning women who do not have FGM performed. However, when it was her granddaughter's turn, when they become of age, she stepped in and said no, for fear of the complications many have due to the lack of medical knowledge of the circumcisers. So even though in our culture this seems to be a barbaric and brutal rite of passage, it has been in many cultures for many years, it should not be outlawed. However, it should be improved upon so that it is a safe procedure and isn't something that is taboo. So although it may not be appearing to all, female genital mutilation is a big part of some cultures and religions, and to be respectful of that while maintaining a safe environment for all should be the main priority with female genital mutilation.